Hi, my name is Bill Turner. I'm one of the orthopedic surgeons here in Longview at Longview Orthopedic Associates, and along with Chelsea and the rest of the team, we'd like to give an introductory talk and help you learn more about the journey toward successful joint replacement surgery. So today we're going to talk a little bit about what brings people to this point where they want to think about joint replacement surgery. We're going to walk through some of the different common conditions and how we treat arthritis and things that give people joint trouble. Ultimately, when those conservative measures don't work, we then begin to think about joint replacement surgery, and we're going to walk you through how that operation works and what the process is for getting ready for surgery as well as getting to a successful result. So we'll begin by talking a little bit about the definition of what these conditions are. The word arthritis is a commonly used term. It generally means inflammation in a joint. The most common forms of arthritis in the United States are osteoarthritis, rheumatoid arthritis, but there are a variety of other types of arthritis. What they all have in common is that there's a loss of function in a joint. The joint surface is no longer able to protect the bone, and that leads to pain, stiffness, loss of function, and sometimes deformity. There are different types of joint replacements that are carried out throughout the body, but the ones we're going to focus on today are knee replacement and hip replacement. These are the most common replacement surgeries done around the world and in the United States, with over 1 million knee replacements a year now in the United States and over 500,000 hip replacements. We're going to talk a little more about knee replacements in terms of what's known as a total knee replacement as well as a partial knee replacement. If you look at a knee joint, the joint's basically a hinge, and it's made up of joint surfaces on the end of the thigh bone that meet the top of the shin bone, and there's a joint surface on the back side of the kneecap that also makes contact with the thigh bone. When those joint surfaces wear out in one, two, or all three of those areas, deformity, pain, and stiffness can result. The primary job of the knee is to be a stable joint and a shock absorber for the body. A full knee replacement or total knee replacement means that all surfaces in the knee are being replaced. This is the most common type of joint replacement done around the world, because most of the time 2 or all 3 of the compartments of the knee are damaged and in need of repair. That operation accomplishes several things. It provides a new surface for the joint to relieve pain. We can correct angular deformities of the knee, straighten the knee out if it's too bow-legged or knock-kneed in addition, and restore range of motion. A partial knee replacement, in contrast, is a condition that happens perhaps 1 in 20 times, where one compartment of the knee is severely worn and needs to be replaced, and yet the other compartments are still healthy. In those cases, we can do a somewhat smaller operation and replace only the side that's damaged. That operation is very similar in terms of concept and similar in terms of recovery to a full knee replacement, although the recovery is often a little faster. Moving on to the hip joint, the hip joint's different from the knee in that it is a ball and socket joint, which allows more universal motion instead of hinge motion. But the concept of arthritic conditions is similar. The joint surface wears down, causing pain and, over time, limited motion in the hip. Hips tend to get more stiff than knees do when they have a more advanced arthritis. The job of the hip joint obviously is to move in several different directions and give us better mobility for getting up and down as well as walking. When we get to the point where a hip replacement's necessary, the operation in concept works like this. We enter the hip joint from one of several different approaches, but all surgical approaches are designed to preserve the muscles that we walk with so that we can have a speedy and comfortable recovery. Once we're in the hip joint, the damaged ball is removed. The socket, which is really part of the pelvis, is not removed. Instead, it's smoothed and made perfectly round again. Then we measure the size of the socket and put a new lining into it. Then the ball is replaced with a ball that fits into the patient's socket. There are many different sizes of people. There are many different sizes of joint replacements, so we always get a good fit. So next we're going to introduce Chelsea, who's going to talk a little bit about the joint program itself and we're going to walk through the sequence of events that gets people ready for the surgery and gets them to a safe and successful result.
Today, I'm going to talk to you about your preoperative education. My role is to be an advocate and support for you through this process from beginning, middle to end. I'll answer any concerns or questions. I'll see you while you're here in the hospital, help with discharge education, and be a resource for you after you're discharged home. You should receive a hip or knee replacement guidebook from your orthopedic surgeon's office. In this guidebook, my contact information is on the first page. There's good information about preparing for surgery, your exercises, after surgery goals, discharge information. As you're going through this book, if you have any questions, you can always call me. You should be receiving a call from the pre-anesthesia clinic nurses 2 to 3 weeks before your surgery date to set up an appointment with them. They're located on the second floor of the hospital at the surgery check-in desk. At this appointment, you'll be doing lab work, an EKG, a nasal swab, and you'll be receiving your CHG shower kit. They're going to talk to you about your home medications. There may be certain medications that they want you to stop before surgery. If there are any changes to your medication list from the moment you have that appointment to when you have your surgery, just give them a call and let them know of these changes. Prehabilitation starts now. We want you to optimize your health the best you can before surgery. So things like stop using nicotine, because this can delay your healing process, maintain a healthy weight, maintain or increase activity as tolerated. We don't want you to push yourself to the point of being in more pain than you already are. So activities such as walking, biking, or swimming. Strength training for upper or lower body. There's pre-op exercises in the guidebook that can help you through this. Start eating a healthy diet, so adequate servings of fruits and vegetables. Adequate sources of iron would be lean proteins or fortified cereals. Low sodium, low saturated fats, and of course decrease or eliminate sweets the best you can. You can also start taking a multivitamin if directed by your doctor. Surgery preparation, planning for a discharge home. We want you to plan to discharge home the next day after surgery. Identify any barriers that you might have with this and discuss with our team before your surgery. Identify your coach or support person early on. We want you to have somebody who's there to help you at home for at least the first 24 to 48 hours or readily available. Make sure your home or the home you're going to is set up for a safe recovery. Surgery time. When do I come to the hospital? You should receive a phone call from our anesthesia clinic nurses about 2 days before your surgery date to let you know what time you need to arrive at the hospital. So if you're having surgery on a Monday, you'll be getting a call from them Thursday afternoon. If you're having surgery on Tuesday, you'll get a call Friday afternoon, and so on and so forth. What should you bring to the hospital? So in your guidebook, there is a checklist, and it has a lot of different things listed, but the most important things that we want you to remember to bring to the hospital would be loose-fitting clothes. Something such as sweatpants, shorts, pajama bottoms, something that's very easy to get in and out of, and easy to get through your exercises. So we don't want you bringing in jeans or any really tight pants. If you have sleep apnea, we want you to bring your home CPAP machine into the hospital to use. Please leave all valuables and medications at home. The surgeon will order your home medications and the nurses will be ordered to give them to you while you're here in the hospital. So the night before surgery, at that anesthesia clinic appointment, the nurses are going to give you the chlorhexidine antiseptic shower. Inside this are instructions, very detailed instructions on how to do the shower kit. It's very simple. You're going to open up one of the sponges. First, take a shower like normal, wash your hair, wash your body, let it all rinse off. And then you're going to open up one of the new sponges, use half the bottle and get a nice good lather going from your neck down. And then the important part is you want to let it sit on your skin for about 5 minutes. This is going to get rid of bacteria and kind of leave a film on your skin to help prevent bacteria from re-adhering to the skin. Rinse it off like normal. Then when you get out of the shower, no lotions, no deodorants, no powders, nothing on the skin. Clean towel and get into clean pajamas. And then in your bed, you need to have clean bedding as well. And that night when you sleep, no pets in the bed. Then you're going to wake up in the morning and you're going to use the other half of that bottle with the other sponge that you have not opened. And you're going to do the same thing in the shower. The nice good lather, 5 minutes, rinse off, and get into clean clothes. The anesthesia clinic nurses will also give you instructions on food and drinking, so follow those instructions and on your medications. Arrival to the hospital. You want to arrive on time for your surgery date. You can park on the second floor in our parking garage, go through the double doors, and straight down on the left will be the surgery check-in desk. Family will be given a tracking number so they can watch your progression through surgery on the tracking board. You'll be taken back to the pre-op area where you can be for up to 2 to 3 hours. A nurse will complete an assessment and start an IV on you, answer any questions, do some teaching at this point as well, and then once they have you checked in, they'll bring, if you would like, your family or guests back to wait with you until surgery. Then the surgeon will come in and answer any last-minute questions or concerns. From there, you'll be taken to our operating room. Anesthesia will start, so you'll only remember them for a second, and surgery is approximately an hour long. From there, you'll be transferred into a hospital bed to our PACU, or post-anesthesia care unit. There you will have a nurse monitoring you waking up from anesthesia. You'll have a blood pressure cuff over your arm so they can check your blood pressure regularly. You'll have a little probe over your finger where they're checking your oxygen level and your heart rate. They'll also be checking your temperature and seeing if you're having any pain at this time. You'll be in the recovery room for approximately an hour. You might have a compression device wrapped around the lower half of the bottom half of your lower extremity. This is a sequential compression device. This will pump air up and down your leg to help with blood flow after surgery. They'll also be giving you an incentive spirometer at this point. The incentive spirometer is a breathing tool that they use after surgery to help open your lungs back up. From there, you'll be transferred to our 7th floor. The 7th floor, all of our Joint Center staff is trained through the program and know how to take care of our patient. You'll be cared for by a physician surgeon, registered nurse, certified nursing assistant, physical therapists, occupational therapists, care managers, respiratory therapists, and pharmacists. Those are just the list of people that you might see in and out through your stay. So the day of surgery, you will be able to order food from our kitchen once you arrive to the floor. Your guest or coach can also order a meal with you while you're here. The nurse will come in and ask you about your pain frequently throughout your stay. She'll be asking you to rate your pain on a pain scale of 0 to 10. 0 being no pain at all, 10 being unbearable pain. You want to be honest about where you're at on the pain scale, because depending on what number you give will depend on what medication she gives you. Tell your nurse if you are having pain. Do not wait. It's easier to get a hold of the pain from the beginning than to play catch up later on. And as you heard from physical therapy, they will come see you the day of surgery. They'll come do an evaluation once the anesthesia has worn off and your pain is at a tolerable level. If your surgery is later in the day and physical therapy does not have a chance to do an evaluation with you before the end of the day, your nurse is trained to get you up and at least take a few steps in the room or dangle your legs. Night in the hospital. We would like you to order your breakfast the night before. Staff will remind you to do this. Throughout the shift, nursing staff will need to check on you and perform vital signs every 4 hours. The nursing staff tries to bundle their care so to give you the least amount of interruptions as possible, but they do have to check on you frequently. Let the nurses know when you need something by using your call light. Don't try to get up on your own. If you're having trouble sleeping, let the nurse know so they can help. The next morning, we wake our Joint Center patients up bright and early. They start getting them up at 5:30 in the morning. Usually a phlebotomist will come in the room to do a lab draw bright and early as well. The nurse and aide will get you up, freshened up for the day, and dressed into your loose-fitting clothes that you brought to the hospital. They'll get you into our recliner chair where they'll make sure to put ice on the incision and elevate your legs. At this point, breakfast should be coming, and the nurse should give you some pain meds to get you ready for therapy. Our physical therapy group class is at 9 a.m., or the therapist will be coming in to do a one-on-one session in your room. After you're done with the group class or your one-on-one session, occupational therapy will come in to work with you as well. When can I go home? Well, this is completely up to you, the surgeon, and therapy. You have to say that your pain is under control, the surgeon has to say that you're medically clear, and then the therapist has to say that you are safe enough to go home. Most of our patients go home the very next day after their therapy sessions. Discharge instructions will be gone over by your coordinator, myself, and the nurse. The surgeon will write prescriptions for pain medication, and they'll also order you to start on a blood thinning medication to help prevent blood clots. Usually this will be a full-strength aspirin twice a day, unless there's other medical reasons why you need to be on something different. This will be specified in your discharge instructions. Some over-the-counter medications that we suggest you have on hand at home would include Tylenol, so you can take that around the clock to help with pain control, stool softeners or Miralax, because the narcotic pain medication can lead to constipation, so these are good things to have on hand. Incision management. So over your incision site, you will have one of two of our waterproof dressings. The first one is going to be a honeycomb dressing that looks like this. And the second one that you might see is called a Pernio dressing. It's not this big foam thing, it's a thin layer that they put over the incision site, and it's held together. Both of these dressings are waterproof. They both stay in place. There's no dressing changes required once you go home, and there's no need to cover them up when you take a shower. We let our patients take a shower the very next day after surgery. Just no soaking in baths or hot tubs. If you have any issues with your dressing once you go home, you just give the surgeon's office a call and they will check it out for you. One thing that happens in the OR is they do what they call a pain cocktail, where the surgeon will inject local pain medication around the joint. This can usually last from anywhere from 8 to 12 hours to kind of help bridge you from the moment you have surgery to when you're on the floor taking oral pain medicine. So that first day of surgery, you're not really feeling you're not feeling too bad. In the hospital, the nurses on the floor will be giving you Tylenol around the clock, and then they'll have the narcotic pain medication to give you as needed to help with pain control. Number one thing, let your nurse know. If your pain is creeping up, let them know so they can give you something to get on top of it. The pills usually take about 30 to 45 minutes to kick in. Post-op day 1, so the day after surgery to the next day, can be kind of the peak of the swelling and discomfort, so you're going to be a little more painful the days following surgery. But it's a different type of pain. It's not that arthritic pain anymore. It's more of a soft tissue pain from the surgery itself. So pain management at home. We suggest that you kind of stick with the Tylenol every 4 to 6 hours, following the instructions on the bottle once you go home, and then you'll be prescribed the narcotic pain medicine to take as needed in between. It's important when you're at home and doing your home exercises to take the pain medication 30 minutes to an hour before you start your exercises. That way you get through them easier, and then put ice on them afterwards. You have a pain medication record page at the end of your guidebook. It's very useful so you can keep track of when you last took your pain meds. If the pain medication isn't working, or if it's making you nauseous, or there's any issues, you can always call over to your surgeon's office. Elevate your legs. A good thing to help with pain control is elevation. Elevation is what's going to bring that swelling down. So with the knees, if you're really swollen, you want to kind of lie back, get some pillows under the lower half of your leg to get your knee up high, and that'll help bring the swelling down. And just normally when you're sitting in the chair, you don't want your feet in a dependent position for both surgeries. You kind of just want them up like in a recliner or upward. With the knee, don't put a pillow up underneath the knee itself. You want to have it nice and straight. For hips, sometimes just getting up and taking short walks can help with pain control. And then of course the ice packs. So these gel packs we will be sending you home with. They are nice, they just lay them flat in the freezer. Don't stack them all on top of each other because it takes a little bit to freeze. So the hips will be sent home with 2, so you can have 1 on your hip and then 1 in the freezer, staying cold. And the knees will actually get 4. So that way you can kind of put 2 on each side of your knee and have 2 in the freezer. You want to do these 20 minutes on, 40 minutes off. And pretty much you don't have to do it every hour while awake, but whatever's more comfortable for you, at least a few times throughout the day, especially after exercises.
Hi, my name's Dawn. I work here at St. John's Medical Center in the physical therapy department. I'm here to tell you about the physical therapy portion of our joint replacement program. The first thing we'll talk about is just the general goals of our physical therapy program. We're going to teach you how to get dressed again, walk with a front-wheeled walker. I'm going to teach you to understand your exercises, how to get in and out of bed, up and down from a chair, managing stairs, and lastly, car transfers. How we achieve these goals is through lots of education. So we prefer that everybody has a coach that helps them through the program. A coach is a person that hopefully can help you through your recovery process. It can be a family member or a friend. They will assist with therapy sessions here at the hospital so that they can help you with therapy sessions at home. Hopefully they'll provide comfort and motivation, and simply said, two heads are better than one. We do 2 replacements in our joint replacement program: total knee arthroplasty and total hip arthroplasty. I don't want you to be surprised when we come into your room the same day as surgery. So you'll have surgery, and then a few hours later, somebody from our department will come to do a one-on-one physical therapy session with you. The first day is pretty easy. However, the second day usually is much more painful. And that's the day you go home. So I don't want you to be surprised that when you go home, you might hurt a little more than you did at the hospital. And we'll talk about some pain relieving techniques next. With the knee replacement, the primary goal is managing pain and swelling. We do this, the nurses do it with pain meds. I do it with ice and elevation. The main thing with the knee replacement is working on the knee range of motion. You want to be able to straighten the leg all the way, and you want to be able to bend the knee. The hip replacement's a little bit different. Our surgeons do a posterior approach, which means they cut the joint capsule in the back. So there are certain motions that they don't want you to do, and they're called hip precautions. So backing up a little bit, with the hip replacement, again, first thing, you want to manage the pain and swelling. The hip is different than the knee. It just doesn't tend to swell up as much as the knee does, but you still want to manage it. Using ice on your hip is an excellent way, and taking short walks. Patients often tell me that if they take a few short walks, that the pain subsides. And of course, with the hip replacement, you need to adhere to the hip precautions. There are 3 hip precautions. The first one is not bending your hip more than 90 degrees. So that means you're not going to bend over to pick something up off of the floor. You're not going to bring your knee to your chest. You're not going to be able to tie your shoes. So no going beyond a right angle with your hip. The second one is not to twist your leg inwards. That's called internal rotation. So no twisting your leg in. The last one is no crossing your legs. That one speaks for itself. We will go over these hip precautions every time we come in contact with you, because we want to make sure that you fully understand them, and it'll just become second nature for you not to do them. They're not forever. You can talk to your surgeon about when you can stop being so careful. So what about knees? Like I said, managing the swelling in the knee is crucial. The more that knee swells, the less it's going to move. It's kind of like a water balloon. If you fill that water balloon up, it's not very pliable. You can't move it at all. If you only fill the water balloon halfway, it's very pliable and you can move it all over the place. So that's the knee. How you manage the swelling is you want to limit your walking for the first couple weeks. Of course, you're going to walk to the bathroom, you're going to walk to the kitchen, you're still going to be moving, but mostly we want you sitting in a chair or lying in bed with your leg elevated. That's the best way to manage the swelling. You can ice your knee 20 minutes every hour. So we say 20 minutes on, 40 minutes off. You still, even with all these precautions, you still need to move that knee. So you still need to work on bending and straightening it. And we'll go over the exercises in another clip. How we achieve these goals is through a group class. Like I said, the first day of surgery, you're going to have one-on-one therapy, but then the following morning, you're going to be brought up to a group class. It's a very small group, usually 3 to 4 people. We like to do the group class because people often learn from each other. It's not unusual these days to have somebody coming in for their second or even third joint replacement. And those folks often add a lot of advice that is helpful. Having gone through, it's probably the best education a person can have. This is where we'd like your coach to join us. The class is at 9 in the morning, the day after surgery. One of us will come up to the room, and your recliner chair will have wheels, and we'll just wheel you up to the group class. Again, I said it's at 9 in the morning. We do it at the same time every morning because we want to make sure that you've had your breakfast, gotten dressed, maybe pain meds if you need them. And lastly, of course, go to the bathroom. It's kind of like getting ready for school. We exercise together in the group class, but everybody goes at their own pace. Some people maybe are just doing a few repetitions. Others may be doing 20. One is not necessarily better than the other. We will be here to help guide you. Mostly, we just want you to learn what to do when you're at home. So again, it's great to have the coaches join us. The exercises are in your guidebooks on page 39. It would be great if you could start them now. I don't believe in no pain, no gain at this point. So if it hurts too much, then just wait until after surgery and we'll work through it. But if you're able, go ahead and start doing them, or some of them. Also in the group class, we'll work on stair training. We have just a small portable staircase that we can practice on. If you happen to have a 2-level house, I may take you into the hallway and do a full flight. Stairs aren't as scary as you think. They're actually sometimes easier than walking. What you'll do is you'll go up with the good leg and down with the surgical leg. I used to say down with the bad leg, but then I was informed by one of our surgeons that they don't put in bad joints. So it's up with the good, down with the surgical. And again, we're going to help you right through that. Talking about equipment, the only equipment that I will talk about is the front-wheeled walker. We prefer people use a front-wheeled walker rather than the four-wheeled walker because it serves a different purpose than the four-wheeled walker. I have people all the time tell me that they got the Cadillac, and no doubt those four-wheeled walkers are the Cadillac. But after an orthopedic procedure, it's better to have a front-wheeled walker because it's more secure. Where do you get the walker? Let's face it, a lot of our friends are getting joint replacements, so maybe you have a friend that you can borrow it from, or a family member. A lot of our second-hand stores in town have them. Goodwill, Habitat for Humanity, they're either side of $10. Love Inc. also loans out medical supplies. The phone number's on the slide, and you can call and see what's available. I'm going to grab the walker now. I'm going to bring it right here. And tell you how to fit the walker. What you want to do is you want to stand up with good posture, and you want the grip right at the bend of your wrist. Right at the bend of your wrist. How you can adjust it is these walkers have a little push pin, and then the leg will go up or down. Make sure you have all 4 legs the same size. So again, good posture, grip at the wrist. I highly recommend that you walk through your home with the walker. You want to make sure that it fits into all the spaces that you need it to. A lot of people with 2-level houses may reside on the main level after the surgery. And sometimes all they have is like a small powder room for a bathroom. Well, you want to make sure that the walker will fit in there. If it does not fit in there, you may need to put up a grab bar. You may need to practice with crutches. Whatever the case may be, it's just better to figure it out before surgery than after. And if you have any questions about it, you can always call me here. Chelsea can always get a hold of me. You can bring the walker to the hospital if you want to. We have plenty to use here. Sometimes bringing a walker just is one more thing to carry. So if you feel like you have it adjusted correctly, then you can just leave it in the trunk. Now, planning for discharging home. Obviously, you want to bring the vehicle that's easiest to get in and out of. A lot of times it's easier to climb up into a vehicle than it is to sink down into a vehicle. That's even true for us healthy people. What you want to do is you want the passenger seat all the way back and reclined. And then you simply back to the seat, sit down, and then turn yourself in. One of our staff members will be helping you out to the car after surgery, but it's good to practice now. It's very important for the hip replacement folks to practice getting in and out of the car without breaking the hip precautions. They say after a posterior hip replacement, you should go home and stay home. They don't want you getting in and out of the car because it's such a high risk of dislocation. So again, just kind of practice that. Make sure you're not going beyond 90 degrees with your hip, you're not turning your leg in, and you're not crossing your legs. Obviously, leather seats are easy to slide on. If you have cloth seats, sometimes it's a good idea just to put a plastic bag on it, like a clean garbage bag, because it will slide on itself and it'll help when you go to turn in, it'll be really easy. Thank you for watching. If you have any questions, just get a hold of Chelsea and we will get them answered as soon as we can. I wish you very good luck and hope to see you soon.
I'm Tina from Occupational Therapy, and you're having a joint replacement. So I'm here to show you some equipment that you can use to help after the joint replacement. Now, if you're having your knee done, probably won't need any equipment at all. Most people who can already get dressed, like reaching your feet for shoes and socks, and you're having a knee replacement, you should be able to do that fairly quickly after surgery. So we'll actually practice that before you go home just to make sure. So most of this equipment that I'm going to show is for the total hip replacements. Because you've got the hip precautions, you're not going to be able to bend that hip past 90 degrees, which makes it kind of hard to bend over, get shoes and socks on, maybe even get your pants on. So I'm going to start showing a few things. I've got what we call a reacher or a grabber. This is something we use for pulling pants on if you need that, pushing socks off, but I have a different device we use for socks to put them on, and I'll show you that. So I'm going to sit down and show you what this looks like to use it. So if you can't bend past 90 right here at my hip, I can't reach forward to, say, adjust a sock or pull on a sock or put pants on, you may be able, take my shoe off, you might be able to dangle those pants down there to get started to put a foot in. Maybe. Maybe not. And if not, that's what the grabber's for. So you reach with this long arm extension to put that down there by your foot and pull on the pants that way. Even if you can get it on your good leg, or your operated leg, you might need that grabber for the good leg. So everybody's a little bit different that way, and we will practice that when you're here to see what kind of equipment needs you have. These do come in a kit with a few other items. This is a long shoehorn, there's a sock aid in the kit, there's a long sponge brush, sometimes there's shoelaces and things like that. And that's something that you can get all together in a single kit, but you can also buy these individually. I want to move on though and show you the socks. Oops, you know what? I was going to show you how to take a sock off. Just by using either the post or the jaw, you can put that down there and push at a sock to get it off. I'm going to show you on my other sock just because I know you couldn't really see that. Just pushing. I like to use that little post there. Some other people like to use the jaw, and sometimes I've found it makes a difference what kind of a reacher you have. They don't all look like this, and there's some little differences in the way they're made. So this is our preferred sock aid. We like this one quite a bit. It's flexible. There's terry cloth on the outside, nylon on the inside. And I'm just going to stick this inside my sock. Lots of different ways you could do it. There's not one single way, but kind of use my body to help support. And the sock's going to go all the way to the, the sock aid's going to go all the way to the toe on that. It's kind of gathered. I like to pull that open because I want to make room for my foot to fit in there. And just using those long strings, I'm going to throw that down there by my foot, put my toes in, point, and pull. Nice little gentle pull, and it should go up fairly well on your leg. I'll do that just one more time. I don't always do this in a demonstration, but it's nice to see. Put the sock on there, gather it up to the toe, open it up, and then throw that down there, put the toes in, and pull. Pretty simple. Okay, now my pant legs are up. You're not going to be able to bend over to get it down, so you're going to have to use your grabber or something else to get those down. Sometimes it takes a few tries. All right. I'm not even going to open this just because, but if I had to put my shoes on, I might need a shoe horn just to help me get those shoes on. And these are kind of tight shoes, so it's perfect here. Okay, so there's getting dressed. Let's move on to toileting. Toilets, there's a couple issues with toilets. If you're a tall person particularly, toilets can be 15 to 16 inches off the ground. And that's pretty low, especially if you're tall, like I just said. You might have to, I'm going to make this one my operated leg. If I bend forward like we normally do to stand up, can you see what's happening at the angle of my hip? I'm bending too far. So we want to make it so that you can stay more upright, or you can adjust things a little bit by throwing that leg forward, not throwing, but placing that foot forward so that that angle at my hip changes. Now I can bend a little bit to it. If I've got a counter or something there, that can help me up, okay, getting up and down. But you could also put one of the toilet raisers on your toilet, and that would raise it up already, and then it's just easier to get up and down. If you're short enough, and by short I mean 5 foot or somewhere around that, you may not have any trouble getting up and down from that toilet. And so that's just one of those things. We'll try it when you come. If you think you need a razor, toilet razor, they come with a clamp on them. They come with a clamp and little handlebars. Lots of different varieties of setups that you can get. There is one with no clamp, no handle. It just sits there, and you kind of want to make sure that that's not too wobbly on the toilet seat, because that's a little disconcerting when you're not moving well to have that moving on you, underneath you. Also be aware that when you go to buy one, toilets come in round and oblong shapes. And so you're going to want to get one that fits your toilet properly. Just be aware of that when you go to the store. I'm not really sure how they're labeled in the store, but I know that that can be an issue. Let's move on to showering. With your shower, you either have a walk-in shower or a tub. So what I've got here is a little frame I'm going to pull over. And this is just a little visual. If you've got a bathtub, what that means is you're going to have to be able to step over the edge of your tub. So it's about that high. If you're having your hip done, you can see that's really not an issue. You just bend your knee, and as long as you can put full weight on your leg, then you can step over the tub. Bend the knee, step over the tub. Both legs can do it. I always recommend having your hands somewhere to stabilize yourself. Of course, you would do that. And you can have that walker there too to do the same thing. If you're having your knee done, that's where you might have a little more trouble, just because after surgery, those knees don't like to bend, especially the bend as far as it's got to go to get up over the tub. And you might find that you're dragging that foot over the edge just because it doesn't want to bend like that. There's little tricks that you can try if you have to. You could put a chair outside the tub to get that sore leg over the top, and then go ahead and step over with that good leg. That's just something you could try if you needed to. Hopefully not too many of you will have to do that. Now, if you've got the walk-in shower, we just have this little lip to step over. and most people, knees and hips, that's really not much of an issue. So, you know, again, you're just going to have your hands somewhere to stabilize so that you feel comfortable getting in and out. The first time you do it, I always recommend that you have somebody there with you anyway. Just, you don't have to be taking a shower. You can do a dry run. Go in there with your clothing, maybe a pair of hospital socks with the grips on them, and just try it to make sure you feel comfortable getting in and out. Here's a picture of the equipment that sometimes we recommend. We already talked about the toilet seat, the riser with the handlebars. The second one from the left there is a bedside commode. You might think that that piece of equipment is overkill, and it's not necessarily. It would be if you're buying it, and I wouldn't really, for most people, I don't think you need to buy something like this. But sometimes people have it in storage, and they're willing to loan it to you, and I would say go for it, because that gives you some raised up height. You can set those legs to whatever height you want, and you've got some arms to push with. Perfect! You got the raised up height and the support for getting up and down, and that should make your life a lot easier. But don't go buy one. They're too expensive to just purchase for this. The other two pictures are showing shower seats. The first one there is a shower bench. You have to step over the edge of that tub to sit on that shower bench. That may or may not be helpful to you. If you can get over the edge, then you could take your time in the shower by sitting on that. But you still have to step over the edge of your tub. You could use that in a walk-in shower also, though, if it's big enough. And then the far right picture is showing what we call a tub transfer bench. And that one is meant to go 2 legs into the tub, as you see, 2 legs outside of the tub. You sit on that from outside the tub and then swing those legs over and into the shower. You don't have to step in at all. You're sitting the whole time. The biggest complaint I have about those is water getting on the floor. There are ways to manage that, so your shower curtain can come down and drape in. You want to make sure that the water drains into the tub. You can also just put some extra towels down on the floor if you're having difficulty keeping the water in. Thinking about your home and your home setup, there's just a few other items I want to mention. Whatever chair that you're going to be sitting in, your recliner, you want to be comfortable because you're going to be sitting a lot more than you normally would. So your recliner, if you're having your hip down, you want to make sure that you can get in and out of it. Kind of like I mentioned earlier, if you find in practicing at home before surgery that you're having trouble getting out of that chair without bending your hip past 90 degrees, there's some simple things you can do. You might think of putting pillows or blankets in the seat of your chair to raise up the seat height. So this is a simple one. That's going to change the way your chair feels. It's also going to change how much push you have with your arms, just because the difference between the seat height and the arm height is different now. So try those kind of things before surgery, just so you have an idea. You might find that if you're monkeying with the chair, maybe a different chair is a better one altogether. So if you raise up a different seat height, and now it feels better for you to sit in longer term. So just try that kind of stuff before surgery. Special bed, sometimes we get that question. Do I need a special bed after surgery? For the most part, no. You should be able to get on and off of whatever bed you've got, unless you've got a low bed and you're tall. Because then we get into that issue again of I'm clear down here and I've got to get up, and that makes me bend too far forward every time I go to stand, because your hands have to be down here on the edge of the bed. So I would be operated leg, and then you go back. That leg can be underneath you to stand on it. And I want to clarify, we have that leg forward not because we don't want you to stand on it, but because of the angle of the hip. As soon as you're up far enough, that leg can be there supporting you. They do make razors that go underneath furniture legs. So it can go underneath a chair or a sofa. It can also go underneath the legs of a bed. So that'll raise up your bed height anywhere from, say, 2 to 4 inches, depending on which one you get. If you need that, they sell them at places like Bed Bath & Beyond. I have seen them in Target and Walmart in the past. Not positive where to get them now, but just letting you know, Amazon is probably a great place to look. Throw rugs, that's another issue for people, because when you're using that walker, I'm just going to grab it. Sorry. You've got the posts and you've got the wheels, and when you're rolling along in your house, we want you to keep your walker on all fours. So the front wheels are going to roll up onto a carpet, these back posts on rugs. So we like you to pick up throw rugs. They don't have to be down. Big area rugs are a different thing. You might be able to maneuver around those fine unless they're really lightweight. So just watch that, just for safety reasons. Okay, the last couple of things on here where we talk about frozen meals and having somebody to take care of your pets, we just realize that you might have those issues, especially if you're home alone. Those might be issues for you. If you've got somebody there, no problem. But if you're home alone and you got to have meals for yourself, just prepare in advance, make it so you can get some food, because you're not going to feel like getting up and moving around a lot to prepare a meal. You're not going to be walking your dog. So things like that, just kind of think through that in advance when you're preparing for the surgery so that you know how you're going to manage little things like that. So, we'll see you when you come for surgery.
So important things that you need to take care of before surgery. Read your joint replacement guidebook. Designate your coach or an alternative extra coach just in case. Obtain a front wheel walker or other equipment that after watching the video you may need. There's good information in the guidebook on page 15 for preparing your home. Optimize your health now. The exercises are on page 39. Buy any over-the-counters that you may need, such as stool softeners, Miralax, Tylenol, etc. Be prepared and motivated to recover. If you have any questions or concerns, please call me at 360-636-4846. Thank you, and we look forward to meeting you.